Hello friends, I am Dr. Sarthak, Associate Consultant at Narayana Health, and on behalf of Narayana Health, I welcome each and every one of you. Today we will be discussing a topic which has got great emotional and social significance. The topic of the day is MI in young or myocardial infarction in young. With me to discuss the topic is Dr. Praveen P Sadarmin, an exceptionally gifted consultant interventional cardiologist with at least 2 decades of experience in the field of cardiology and more than 35 research papers under his belt. So, hello, sir.
Thank you, sir.
Welcoming
It's
you.
very kind of you to introduce me. And it's good to be back again for our further
Yes.
health talks. So
Yes,
look forward to this one as well.
sure, sir. So, what is a heart attack?
So that's, I think, a very relevant topic. As you said, it carries an emotional attachment, and it's been in the press of late.
Of late.
So
yes.
obviously, the Kannada superstar Puneet Rajkumar
Yes.
died very suddenly. A couple of days back, Raju Srivastav,
Raju
who was
Srivastav.
a very famous comedian.
Yes.
So he's died suddenly with heart attack.
many more.
Many. I'm just listing one or two.
Businessmen, tycoons, industrialists, athletes.
Absolutely.
So
So it
many.
doesn't spare anyone. So rich or poor, it doesn't matter. So
And apparently healthy people.
apparently healthy people. That is very true. So that is why it says, if someone has been suffering for some time, there is that acceptance level. When, someone who is apparently fit and healthy,
True.
and they die suddenly, that is very difficult to take
Difficult
for
to
anyone.
fathom,
It doesn't
and
matter whether it's one family or the other family. All families are the same.
Right, sir.
So heart attack is where there is loss of blood supply to the heart. So there are blood vessels that supply the heart, like to all the parts of the body. Even the heart, which is a pump to the to all the organs, that itself needs blood supply.
Yes.
When there is a sudden cutoff or sudden blockage, that causes the heart attack. So there is no blood supply to the heart. The heart cannot function. So that is when it starts to call for help. That is what we call angina or pain.
Pain.
So it manifests in different ways. Some people have chest pain when going to the left side. Some people it goes to the shoulder. Some people it goes to the jaw. Some people it goes to the back. So there's no one single symptom I can say will definitely, by symptom you cannot say someone is having a heart attack.
Sometimes even gastritis and
Yes, that is the most common thing people say.
yes.
Sir, I thought it was gastritis or a bit of gastric problem, gas being trapped, and things don't change at all. This is a very, very common recurrent theme when people mistake heart attack for gastritis. And some patients, especially diabetics, you don't get any symptoms.
Yeah.
What we call silent heart attacks.
Silent.
So there are a range of ways people can present with heart attack. The only thing that will help someone if he is listening to this talk, what I would say is have a high suspicion of high index of suspicion. Where you think something is not right, go and see the doctor, go and see the right person.
True, sir. Truly, sir. On that note, often in our practice we come across patients or patient family members who confuse these two terms, cardiac arrest and a heart attack. So could you explain exactly what is the difference between them?
True. That's a very relevant topic. But once again, cardiac arrest is something that you can hear people say he was absolutely fine and he suddenly dropped dead.
Yes.
So it's a sudden cardiac arrest. So the heart stops. So there are various reasons. One, heart attack is one reason. Excuse me. So for one of the most common reasons why the heart stops is the heart goes very fast.
Yes.
What we call tachycardia, or the heart rate goes very up. Ventricular tachycardia, ventricular fibrillation, where the heart rate can go up to 200, 220 as well. That is when the heart will not be able to sustain, and then the heart stops suddenly. So that is the most common reason. And then stopping of the heart, that sudden stopping is called cardiac arrest. Heart attack, as I told earlier, there is blockage in the heart blood vessels. So that is heart attack. Heart attack can lead to cardiac arrest.
So coming to the next point, what are the risk factors of having a myocardial infarction or a coronary artery disease for specifically our Indian population?
Good. See, probably not necessarily Indian population, the South Asian population, we have a slightly higher risk compared to the rest of the world. Okay,
Right.
so we're genetically more prone to have heart diseases. So that is something we're carrying that extra baggage. On top of that, I'm afraid we are becoming number one in cardiovascular disease, diabetes, hypertension.
Yes.
So we have become number one in all these diseases. So we are adding more and more risk factors. So the traditional risk factors, what we call is diabetes, hypertension, or high blood pressure, and smoking, excess alcohol intake, unhealthy food, sedentary lifestyle, drug consumption, recreational drug consumption. So, and stress is something that it's like the new kid on the block. It's
Yeah.
been there for the last probably I would say about 5 to 10 years. So these are the traditional things. If we look at the heart attack in young people, I think the first thing I would want to say is, how do we define young people?
Yes.
So
yes.
because that's the key question. So who is young? Because recently I have done an angioplasty on a 23-year-old guy.
Yes.
So it is very hard to believe when I tell someone that I've just done an angioplasty on a 23-year-old guy. It is shocking.
Yes.
Okay, because nowadays every patient I see, I have to view them with a suspicion that there could be underlying heart problem. Previously, maybe even 10 years back, in the young, I would say less than 30, 35, even 40, our suspicion for heart disease was very, very low.
Yes.
Nowadays, I'm seeing, as I said, a lot of patients in their late 20s, especially 28, 29, 30, 35. The numerous patients I can have.
Particularly
so
the early 30s seem to be a
30s,
dangerous
40s, for less than 50, there's a huge burden of disease. And this is something I had not seen either in India or because I used to practice in UK, where young would be someone more than 50 or that's what we would call young. Between less than 60, 50 to 60 would call as a young patient. But now the definition of young is actually gone, because in anyone above the age of maybe 20 now, you'll have to start. Maybe I'm exaggerating, but I think given that so many patients I'm seeing in the kind of late 20s
we
and 30s.
see quite a few numbers of them at our center.
Absolutely.
Here.
So
True.
that's something that's actually changed.
True.
And some of the risk factors, particularly for these young patients, are one, obviously the traditional risk factors. We are also more prone to diabetics. I'm seeing a lot of diabetic patients. One of the things that we would say is, diabetes, usually, what we call the microvascular and the macrovascular complications, like, having eye disease, heart problem, kidney problem, those sort of problems, complications from diabetes. It used to happen after 10, 20 years after diabetes. Now they're happening much earlier. Okay. Obviously, I don't have any scientific data to back this up, but that is what my clinical experience has been. So we are seeing patients much earlier. Even female patients, where we used to traditionally think estrogen is protective.
But with diabetes, the estrogen will not be able to protect.
That protection is lost.
True.
So lot of, not only men, obviously heart disease is more prevalent in men, but a lot of female patients are also picking up. One of the other reasons is smoking. There's a lot of young women who started smoking. Although the overall trend worldwide for smoking has gone down, trend especially, probably this is for worldwide as well, the teenagers or the younger population picking up smoking, especially females, has gone up.
Yes.
And the way smoking affects men and women are totally different. Women are more disadvantaged when they smoke compared to men. I'm not saying smoking is good for men, but
the risk is definitely more for females.
Same. Even the same with alcohol.
Yes.
So the metabolism of alcohol, smoking, and all these things is totally different in men and women. So, but the sad part is a lot of people in India as well, a lot of women as well, girls, especially girls, teenage girls or kind of younger age girls, are taking up smoking.
Peer pressure.
Absolutely. So that is something. Those are things that probably has increased the risk of MI. Two other important factors that I would want to highlight here is drug use, recreational drug use. That has become very common as well. Now it's a new fashion. Previously, it used to be limited to a very small section of the society, especially college going or someone who is really at high risk of all these things. But even those categories, that risk itself or those acceptance levels have changed in society.
Yes.
So it becomes a fashion to smoke. When you go to a party, it becomes a fashion to take drugs. So those acceptance levels, what are the norms? Whatever used to be, say, about 20 years back or 10 years back, has changed already. So it's okay to smoke, it's okay to drink too much, it's okay to take recreational drugs because you want to have fun and enjoy life. Enjoying life is not at the cost of your health.
Even death.
Death, yeah. That is very true.
And these patients apparently are even sometimes they'll end up having a MI without a coronary artery disease.
Absolutely.
No blockage, but then they have.
Especially with cocaine.
Yes.
Cocaine is probably still harder to get. I don't know the actual statistics, but I've heard that it is very prevalent in Bangalore or any metropolis cities.
Metropolitan cities.
So it's very common. The other thing is
even binge drinking of
binge
alcohol.
drinking, absolutely, or ganja, cheras. All these things do have adverse effect on the cardiac muscles as well as the coronary arteries. They lead to spasm. The arteries just close down, and that causes heart attack. So we've seen this time and again.
True. And women in this scenario, younger women also, somehow they are more disadvantaged in terms of having connective tissue diseases. So a little light on the symptoms, the presentation of young females. They may be aware or they may not be aware that this could be a possibility. So something on those lines.
Correct. So awareness has to definitely go up, because once again, as I said, awareness has to go up among doctors as well. That is something that I'm seeing time and again. Because obviously, as the society has changed, even we need to adapt. We need to, because one of the things that happened when Puneet Rajkumar died is a lot of patients landed up in the hospital. They want to say, "Sir, is my heart healthy?" True. I mean, that is good in a way, because I picked up a lot of patients who were totally asymptomatic. They had significant blockages in their heart, and then they went on to have treatment. But there's the other spectrum where a lot of healthy patients started worrying unnecessarily. One of the other things, as I told earlier, stress is something that has become universal. So it has become a fashion to have stress. Even if you ask a school-going child of 5 or 10 years old, they'll say, "I got stress." You speak to someone who is retired, who is in the 70s, 80s, kind of,
they are more stress-free.
They are also very stressful.
Okay.
So they are stressed for their family, their kids, their grandkids. So the stress doesn't end. The one thing which has changed over the last 20 years is the advent of stress in society. Not in just some people. It's become universal. So, and there are lots of studies which say stress is equally as bad as smoking.
In fact, as bad as having a completely sedentary life.
Absolutely. So stress is really, really bad. That one key message probably I would want to address people is try and minimize the stress, because stress is really bad for your heart.
True. One point of note that I have been noticing of late, and which I wanted to discuss with you in this regard. We often see in the young patients who come to us with the existing myocardial infarction and who are undergoing treatment, their triglyceride levels are usually on the higher side. Could you throw a light on why it is so and what they can do to help it?
Correct. So that is once again we see in Indian population more. There are certain factors. Obviously, there's something called a familial hypertriglyceridemia, which means that it is genetic. It can be passed on from family members, but that is a very, very small percentage. Probably I would say less than 10% of what we see. But most of them are related to diabetes. There's a strong association with diabetes. Once you are diabetic, your triglyceride level goes up.
Yes.
Okay? And even without diabetes, I'm seeing a lot of patients with high triglycerides.
Yes.
So why that is the case? Maybe is it because of the sedentary lifestyle, because of the unhealthy food habits that
the
they
junk
have,
food is
the
that
processed food? Possible, definitely there should be a connection. So it's very difficult to prove
high TG content food.
Yeah, it's very difficult to prove which food is associated with it. But what we do know that is processed food, what we call the junk food, they are all, they are very poor in fiber content.
Yes.
They're very rich in cholesterol, sugar, salt. So these things tend to increase all your bad cholesterol. And the other thing is we're seeing patients who have normal rest of the bad cholesterol levels, but the good cholesterol, the HDL levels go down significantly. Even that is a bad prognostic marker.
Yes.
So So it's not only important that you have a control of your bad cholesterol, it is also important that your good cholesterol is high.
Yes.
Otherwise,
this is
you
what we
don't.
see in the studies also.
Correct.
High triglyceride levels, low HDL levels.
Correct. So that's something. The only way, unfortunately, there are no means to like low medicines to increase your HDL levels. So the only way it goes up is a healthy lifestyle. Obviously, more of walking, exercise. So those are the only things that has proven that it will increase your HDL levels.
HDL.
So once your HDL levels improve, that increases or decreases your risk of further heart attacks. So it is so important that getting your bad cholesterol level is so important. Equally important is your good cholesterol level to come up.
True.
Otherwise, you don't benefit to that same extent.
Same extent. True. So, what would be your take-home message to the young audience out here about how they can, first of all, prevent a myocardial infarction, a heart attack, and if unfortunately they have been victim of this disease, how do they have a healthy, good, fruitful life in the years ahead? Because they have a long life ahead if they have survived.
Correct. It is unfortunate that we are seeing a lot of patients with young MIs, so young heart attacks. That has a lot of implications, like financial implications. We
Yes,
see many times that they lose their jobs, or even if their income goes down because they're not able to work full time.
Yes.
Or the family members who were working before, they have to leave job to kind of look after them. So that is a double whammy.
Yeah.
And obviously there's an emotional attachment to that, and they might be the only breadwinner of the family.
They could be quite
So
possible.
that has got huge implications, and along with it the emotional implications as well. And on top of these things, these patients do end up having complications because obviously they are young, they have got a much longer life ahead. Their lifespan is actually cut down.
Yes.
They're going to die much earlier, that is the truth. And they end up with complications of heart failure. That is the one thing we see time and again, where the heart pump starts to fail. All our interventions, treatment is aimed at reducing the incidence of heart failures. Because once there is heart attack, there's nothing we can do. The damage is already being done.
So how do we go about preventing them in a stepwise, clear-cut manner? How can we help avoid as much as possible having an incidence like that?
Good. I think the first thing would be to try and avoid having a heart attack.
Yes.
So to have that modification of all the risk factors. Okay. The only thing that we cannot modify is the genetic risk, that is less than 10%. So it's a very small risk that we don't need to worry too much about. The rest, all 90%, is lifestyle. So we need to be making sure that these people understand about the importance of a healthy lifestyle, because there has to be a distinction between health and disease.
Yes.
Once it is disease, it's already too late. So we need to be thinking about preventive health and making sure that they're not sedentary, stopping all the vices, smoking, drinking, alcohol, drugs. So all these things which you already discussed, and getting regular checkups. That's very, very important. Now,
even for healthy young people,
I would definitely recommend. See, my cutoff was initially about 40 years. I would say annual health checkups for anyone above the age of 40.
Yes, that's what we would hear our
But now I think I'm
speaking.
coming down to 30, 35 plus, depending on risk factors, because most of these young patients are in their late 20s or even the early 30s. So my worry is that if we don't screen them, we might miss these
We might
people.
lose them.
Correct. So where there is high suspicion, start screening them. Start doing basic tests, ECG, echo, blood test, and obviously we are lucky now that we have got CT coronary angiograms. That's going to tell us about whether there is any coronary artery blockage or not, and we can treat these patients earlier before they can have a heart attack.
True.
So that is something that is actually revolutionized treatment. It is simple, it is available, it's universal. So it's available most of the places in any big center, and there's a lot of information that we gain.
Yes. So without having to undergo
any invasive procedures.
Any invasive procedure.
Correct. So that is something, that's one thing that has revolutionized over the last few years.
Yes.
So we need to probably utilize more and more of that service, because nobody wants to undergo a procedure unnecessarily. If it's an invasive procedure,
even we don't want to do it.
Absolutely.
As much as possible. We want to avoid it.
My practice has changed significantly in that most of the patients with low risk, they all have CT angiograms, and that is what all the international guidelines recommend as well. So why subject them to an angiogram where we can get some information with a CT scan which is non-invasive.
Non-invasive, yes.
So-
yes. Point to note here, dear friends, there is a difference between the regular coronary angiogram and a CT coronary angiogram. So a CT coronary angiogram is done by a radiologist on an OPD basis, a non-invasive test, while a regular coronary angiogram is done by an interventional cardiologist on an inpatient basis or as a daycare admission basis. So as a screening test, CT coronary angiogram is probably one of the best tests that we have at present to rule out a coronary artery disease.
Correct. I definitely agree with that. And anyone, the final message would be anyone who think they are at risk, for example, if they have any of these risk factors that I have mentioned earlier, go and see the cardiologist. Let them make an assessment and then do whatever is necessary. So 90% of the time, we don't need to do anything further. I can easily say, fine, everything is fine. I can reassure them and send them back. But that's something that should be more
Let
accepted.
that reassurance come from somebody who is a trained person who knows
Correct.
whether you have a problem or not.
Rather than sitting at home and waiting for an event to happen.
Absolutely agree to that. So on that note, we bid adieu to all our friends. May you all have a healthy, happy heart. Thank you.
I think the key message is once again, healthy and happy heart.
Yes.
Thank you.